In bariatric surgery, the key to bariatric surgery is to have a successful program. All right. Part of a successful program is not only the psychologist, the dietitian, the exercise physiologist, but it's also post-operative follow-up by doctors. Successful patients, and I mean greater than 99% of all successful patients, follow this modality. Typically, you want to have a program that the patient will come in, and the program is different, and it has to be tailored for different patients. Gastric bypass patients have a different program where they will see the dietitian and the exercise physiologist and the psychologist and the doctor, and these patients have to be followed closely. And typically we want to see our gastric bypass patients sometimes twice a year. Initially in the first year for a gastric bypass patient, I see those patients at 2 weeks, 3 months, 6 months, 12 months, and then subsequently every year thereafter. But even in the second year, sometimes it's twice that second year, and then subsequently every year thereafter. And then they have to have somewhere where they can call for any issues or problems, and that's why you have to go to a program with a bariatric surgeon that has bariatric surgery coverage 24 hours a day, 7 days a week. Okay, and there are no taking off nights or weekends or holidays. It should be 24/7 coverage, and that should be for all bariatric patients. Lap band patients differ because a lap band is a little bit more intensive in terms of the follow-up. Lap band patients, we typically see them up to every 6 to 8 weeks for band adjustments if needed. And because the lap band patient's weight loss is more gradual, typically it's about 1 to 2 pounds per week, we want to make sure those patients are on target. And so those patients we follow more closely. And also the doctor also needs to see these patients, because in our practice here, the doctors do actual band adjustments. In other practices, sometimes a nurse practitioner will do it, but in our practice, the physicians do it. Because we want to catch subtle differences in our patients in terms of any potential complications before they come up, so we can nip it in the bud. Now, in terms of gastric sleeve patients, we follow those patients sort of at the gastric bypass level, which typically in the first year is every 3 months, and then in the second year twice, and the third year yearly thereafter. And we want to also make sure that they're doing well as well. And a battery of tests are also performed, when they come into the doctor's visit, depending on what their situations are.